body really brings up a lot for everybody, and that is us as therapists and also clients a lot. And we're going to jump into this magical connective tissue. We're going to move. I'm going to all the way today. Please keep having a drink and having a move. We're going to look a bit more into the physical, right? So we're going to be looking at physical stuff. So noticing your tension and where that's happening inside of your body. And of course, there'd be no point in doing this and bringing all this science to it if it didn't make people well. There are reasons why we're doing this. And this is where we're looking at potential for growth and healing. This is why we're all here today, to look at those bits. So let's get on to a bit of learning here. Today, we are going to increase your knowledge of fascia. How do you say it? It's a funny word to say. So for me, I think of the runner, John Fascia. He might have been a footballer. Did he have a brother? Was it? I think if anyone knows that, please put it in the chat. So fascia, right? Because I'm dyslexic. I mean, that word means nothing to me. And if you Google it, you get loads of pipes outside people's house, rain pipes, which I think is hilarious. So it's fascia. We're looking at mind-body connection. So, but when I say mind-body, we're bringing in the unconscious. So I want you to right now, the unconscious, the shadow. What is that tension? Why is that side different to that side? Is it because my bag's on this shoulder? Think of your clients. It's the unconscious manifesting in the flesh. So we're bringing it back to, if you cut me, I'm going to bleed. We're bringing it back to that. And we're going to really look at the why. What are the implications for mental health and how we can begin to notice this in your work? And we've already started that. It's the noticing and noticing in yourself as well. We were working with clients yesterday, what's going on in your back, your neck, your hips, and the counter transference. So what is wonderful, one second, is that fascia is sort of a thing that's spoken about in yoga. A lot of yoga people will be aware of it. And physios, right? And there's no real connection between a physio brain and a yoga brain. I was here, sometimes we get physios on here. But what is wonderful is that there's now more science in this area. And I'm so thrilled. And this beautiful image that I used on the flyer, that in May, this was the front of the New Scientist magazine, right? So the matrix inside of you, a guide to fascia, the vital organ you never knew about. So we're really at the early days of this. So it's so cool that this interest is there. So cool. So one of the reasons that I trained as a yoga teacher and then a psychotherapist was because of my own healing from physical pain caused by emotional stress. And this is why I do what I do, because I'm so interested about discovering the science, not just the yoga stuff. I was aware I had to train to be clinical, because I can't take that stuff and talk to a consultant in the hospital or talk to a doctor. We need to be able to bring some more science to this space. So the more science we can bring, the more GPs, mainstream medicine, and the public will begin to understand the power of working with mind body. So I'm going to encourage you. You might think, oh, I'm not a scientist. There's keywords in here that I'd like you to begin to swallow. And how are you going to start to put this into your narrative around your work, about working with the fascia? And because the more science we can bring around this area, we can start to look at how to treat mental health, chronic conditions, and I'm including here pain and inflammation. It's very relevant to this area, pain and inflammation. Think about your clients with pain and inflammation. And also this is early doors. So I'd imagine this is in 3 to 5 years, 3 years time, more people will know about this in the mental health field. This is new at the minute. Maybe it's where the vagus nerve was about 3 years ago. So this is a really, really new thing here. And then also it's so our clients will start to understand more. It's not just for us to know about it. We want our clients to know about it so they can know what's going on, so they can notice, so they can make tiny, healthy choices, and also make choices about their own medication, health, and have awareness of what's going on in their body. So for me, when I was sort of in the late 90s, I used to work in London, had a stressful job. I was always going out to parties, drinking too much, taking drugs. Sorry, I'm choking on a nut. That's about as exciting as I get now, by the way, having a bag of posh almonds. Not back then. And this, I didn't realize that I had a stressful job, which I just thought was, I used to just enjoy it. Really, I was always at work. I didn't know. I used to wear high heels all the time, and I really hurt myself. Basically, my lower back started hurting, and this went through to my pelvis area. And it was something called the psoas muscle. I didn't know anything about it, but I went to see a physio because at one point I couldn't walk. And the doctor didn't know why I couldn't walk. I couldn't walk. And I was in America and couldn't walk. And I nearly had to get flown home from America. I thought, oh, hang on, what's going on here? I had no clue what was going on. So this physio that I saw, actually it was in Richmond in London, random fact. He said it was my psoas muscle, and he told me that it's in the lower back area, extending through to the pelvis, and it is the connective tissue. It's the fascia. First time I've heard of this. And actually, problems with the psoas muscle are, as I now know, are thought to play a major role in many mental health issues: depression, anxiety. Think about where that is. Hip pain. Think about mobility, hips. Just think about your clients here. And at the time, this would explain my low mood at the time. But I did, and he actually suggested that I start doing some yoga, which I did. So I got a DVD of a lady called Vimla. I did get in touch with her the other year, and she's still going, and she said she just was happy I'd got in touch, and she told me to keep going. And I would do this DVD in the house. I didn't go to any classes then. And it really did make a difference. So the more that I practiced yoga, the more my physical pain went away, the more I changed my lifestyle, which I did change quite dramatically. My mood was great, the depression was gone, and I needed to understand why, really, what was going on here. So after I had been doing yoga for about 6 years, I went on a retreat in Mexico, and they did something called yin yoga. I'd never heard of it, but I liked it because you didn't actually have to do much. You just sort of lay down and wrap yourself in blankets, and it was really nice. So there's some images here of what it looks like. And at the time, it was relatively unknown in the UK. And I've got a DVD of a lady called Sarah Powers. If you're interested, please look her YouTube videos up, and she does live events. And I'd actually been to try yoga in London and went and met her. And for the first time, she was talking about the psoas muscle, connective tissue, fascia, and mental health. So with yin yoga, and I'm sure a lot of you would have heard of yin yoga now because it's a lot more popular, it's much more slower and gentle and a nurturing practice. It can be boring, right? So I would never look at doing that in the morning for me because I'm full power, but it's something, because it's slower. So you've got to be, if you're full of cortisol and adrenaline, you can't go to that slow space. But the postures, you hold them for longer periods of time. And what you do is there's a lot of focusing on the exhalation. So you are engaging the parasympathetic nervous system. You're finding your edge. So if we can do this together, if you just gently drop your head to one side, and I'd like you just to notice what's going on the side of the neck. Let's take it on the other side. And again, notice what's going on that side. So you choose, you might go back to the other side. There might be some clicks and pops in the neck. You might want to take that round. It usually sounds like a bowl of cocoa pops with some milk poured in my neck. So it's just noticing, we're noticing then edge. So with your neck, you could push it further, but that may be harmful. So we're noticing that edge and breathing into it and even backing off from it. Yeah. So she spoke, there's a picture of Sarah here, and this DVD, if you go on my YouTube channel under playlists, I've put the DVD of hers on there. It's broken down on YouTube. because people don't have DVD players anymore. And she spoke about this soft skeleton that's keeping us all together. It gives us that boundary or edge, because think would be like Bambi otherwise, wouldn't we? And there's enormous growth for potential when we integrate breath and movement. Okay, and I'm just going to give a quick shout out here to, again, I'm talking about yoga and where it is today, and think about some of the client groups, maybe more diverse groups, or people who have access issues, or think that the yoga's for the skinny white rich people, right? So there's a bit of a whitewash in yoga. So this isn't something I'm going to talk about in depth today. However, if you're interested, I'd recommend this book called The Yoga Manifesto. It's a new book by a lady called Nadia Gilani, and she is challenging yoga and its whiteness and its fact that it's full of narcissists and commercialization and cultural appropriateness. So I would really recommend this book if you're interested in that area, or if you're looking at working with people from diverse groups. Really have a look at that. Chapter 11, she absolutely nails it. Okay, so the fascia. There is potentially here a huge role for it in mental health. However, there's still so much for us to learn about this connective tissue. So see this image, it is literally like we have a spider's web within us, under our skin. We'll go into the science bit in a bit, yeah? But how can we begin to integrate this into our work? Because science has actually neglected fascia for a very long time. It's been thought of as inert and lifeless. But as the science is now showing, and the curiosity, and as physiotherapy people and mental health people and yoga people like we're doing today all coming together, there's a real area there where we need some research. However, like I say, science has neglected it. And I put a picture in here of, can you see this image of this lady in the corner? She's called Ida Rolf. Has anyone heard of Rolfing? I think somebody mentioned that had fascia release. So I'm just, again, I'm just going to bring forward here that there's a gentleman called William Reich, who was known as the father of body psychotherapy. Ida was one of his students. Her work, yes, it's been taken up within physiotherapy, but she was working in mental health. She's a therapist that brought this in. So as she was female, her work, her papers weren't published. She's not as famous as the men, because there's a timeline there when we're looking at the 40s and 50s and 60s. So I'm just bringing that in, that actually science has neglected fascia and the work of women and people of colour. But I'm bringing this lady in particular, and we'll pick up on her in a bit. So fascia, right, for me, it is the bridge that I've been looking for a long, long time, because this web, so if you have we're going to go into the body a bit more. I just don't want to scare you by showing dissected body parts so early on a Saturday morning. But the fascia, have a look at that image there. It's interconnecting, right? And it's given us something physical to put our finger on. And actually, in the history of body psychotherapy, it's missing. And then I've just mentioned that Ida she's seen as the mother of fascia, yet her work doesn't really feature unless you really research it. And I've had to really, really look and connect. It's not really there in body psychotherapy. So there's something physical that we can put our finger on, something more intelligent and interconnected than muscle memory. Yeah. So as therapists and people working with clients, noticing in our own bodies, we've known that there's something missing. And this is why fascia has tremendous implications for mental health, because actually the connecting nature of fascia has meant in the past that it's actually crossed several scientific models and disciplines. And most of the research is actually not from mind, body, or on the therapeutic side. There's very little there until recently, but it's coming from the mechanical body therapies, physiotherapy, But like I say, this is changing now, which is wonderful. So I know a lady just mentioned the book before, but today therapists and clients, this isn't 5 years ago. The clients know about trauma. Everybody's talking about trauma. Wim Hof's on the BBC getting celebrities talking about their trauma. Never have people talked about trauma. The clients ring you, I've got trauma in my body, right? I want to work with you. Or it's there. Not all of them, but they know it wasn't there. It wasn't there as much 5 years ago. So we know that emotional stress and trauma gets stuck in the body, and that the body keeps the score. Someone mentioned that book earlier, right? The body keeps the score. I'm sure you've all read it. If you haven't got it, have a read, stick it on the audiobook. I bump into people that I've taught the trauma-informed yoga with, and they're like, one woman in lockdown, she actually had it on she was listening to it, asking me about neuro reprogramming or something that Bessel talks about. So people know it's in yoga studios now. I was in London and it was in yoga studios, right? He's brought science to this, okay? The body remembers. I've got that one as well. A bit older. Babette. I'm sure you all know about a lady called Babette Rothschild. Bessel's sort of taken the famous thing. She's older. She's a really cool lady. But even she says until Bessel wrote this book, all the body psychotherapists were just seen as a bunch of sort of woo-woo hippies, right? Not taken seriously, really. But this changed it. This has changed it. And Gabor Mate, the body says no. But again, there hasn't been a lot of science to explain where this is manifesting in the body. So I'm just wondering how that sits with you and your own work. Maybe, and if there's anything, other books coming to mind, anything you'd like to share, please pop that in the chat. So people today, which I'm really happy about, this awareness of this, and we've got this workshop, and and it sells well. And it used to be, I was always thought it was a miracle people showed up, sort of like 8 years ago when I started this. And I'm so happy that we're all coming together now in this. But people often may speak about, and I'd like you to hold this in mind, that working with the body is like a magic alchemy, right? And that as if we're seeking some magic intervention, or I don't know, Lorna will come and touch you here and the trauma will go. This is no quick fix. I need you to be very clear with yourself and your clients that this is no quick fix. And if they've come to therapy with you for a quick fix, it's not gonna happen. There's no magic potion or alchemy. However, we'll get to the healing bit, but it's not a quick fix. So nothing can be learned in a 3-hour, nothing that is the quick fix is going to be learned in a 3-hour workshop, and that the trauma is going to disappear. And this is because there is healing emotional and physical trauma involves many layers of work, and it takes time. So there's a commitment there and a reality for yourself in the work, and also that we're really clear with the client that this is early days. And also our clients do really need to be involved in this. Luckily, they have the language now, they know about trauma in the body, a lot of them. But unless they're involved, then we're just keeping all this sort of academic stuff in our head. And actually the client needs to feel the change somatically in their body. There's loads of books written about, thousands of books. Between us all, we've probably got thousands of books on this subject. Unless your client, feel the change in your body, you will not go back to that yoga class. You will not be able to question it. You will not continue with the therapy. It has to be like we're noticing. Again, I'm going to ask you here just to begin to flex your spine. Notice your own stiffness when we're talking. Unless we feel better for the stretch or for having a drink, we're not going to do that again. So it's really holding that in mind. So fascia, it's known as the organ of form. Form, as in, when you think of dancers and having a form, or Is that what weightlifters do as well? You'll have to help me. Do they have the right form? Please pop that in the chat if you know about that. I'm sure they say about form. Okay, so it's from the top of your head to the tip of your toes, right? So top of your head, right? And then I want you to wiggle your toes. Look at your toes, pull your toes back. Feel that stiffness in your toes. Squeeze it down. So all the way. It's a continuous silver white bodysuit that surrounds, separates, interpenetrates, and envelopes all of your organs, brain, muscle, bone, blood vessels, nerves. So I'm going to shout out vagus nerve here. All of your body. And it's made from collagen. It's connective tissue, which is an abundant protein in the body. It is slick and slippery, like fluid, right? It's a fluid body. So think about Spider-Man's suit. I put an image there. And I tried to find a female one. So where it is, and it keeps us all together. Happy, healthy fascia will slide and glide gracefully, unrestricted. It is intelligent. The fluid, again, this is why fascia loves fluid. The fluid conducts information around the body. It's like having the best Wi-Fi signal in the world that's going from the top of your head to the tip of your toes. Okay, so it loves to be warm and it loves to be hydrated. And what it's actually lubricated with is hyaluronic acid. So I'm going to just, if you can see my little square here, I'm going to put this up here. Can you see this on my hand? So this is in probably all of the moisturizer and skincare that you're using. You might have seen it, people going mad for it over lockdown. So it's this slippery, like thick water, and it's the body's hyaluronic acid that keeps the fascia moving and sliding. So I love this quote. So there's a dynamic liquid. I'll just use that up because that's very nice. So there's a dynamic liquid crystalline continuum of connective tissue, an extracellular matrix. Think about matrix, linking directly into every cell of the body. Every cell of the body is communicating. So I put some images up here that are quite useful. So imagine, and there's a lot of where muscles cross. So you see this on the back of the spine on where muscles are crossing. And just think about when we're happy and healthy, and when we stretch. So it's really useful that we stretch off to the side. So maybe let's just practice this, just taking a stretch to the side. You might want to breathe into that, lengthen, and then to the other side, maybe having a gentle twist. So taking one hand to the opposite knee, gently twisting. Notice your edge, don't overdo it. Can you back off from your edge? Look at the fascia in the horse. Look at the back legs of this horse. Absolutely beautiful. The fascia moving, syncing with pace. And bodies, think about aging. There was a lady who mentioned was she a midwife? Someone working with babies mentioned here. I wrote it down. Aging. So this image is a lady called, I've got a book here to show you, called Vandra Scariavelli, right? So she didn't start doing yoga till she was in her mid-50s, and she was taught by Mr. Iyengar. But look at her here. She was going to her 90s, right? Look at her spine, absolutely fantastic. And this guy, look, he's in great condition, right? Look at the fascia, the muscles moving, healthy, hydrated. And also, was it Amy who worked with babies? I can't see the chat. Just hold in mind a newborn baby, right? When they're moving, the fascia, right? But also I saw this image this morning, even, can you see that's in utero, the spine beginning to develop, the spine in utero, the fascia. Look at the fascia here. Wonderful. But if you think about a happy baby moving, and if you have interest in fascia, which I can hear you all do, but you want a bit of the science stuff that is easy to read and not too sciencey or boring, I have to recommend this book. This is really a good starter book, and it's called Fascia, What It Is and Why It Matters by David Lessendak. So, you know, you might need to help with that one if I've to put it in the chat for people. So he's just quite a geeky, funny, enthusiastic, as I found quite a few of them are actually, and you'll meet another one in a minute, scientist who loves the fact he's more physio, so it's physical, but that's a great book. I'd really recommend you get that book. That's the back of this workshop. Brilliant. So yes, we're all happy. Everything's moving, everything's warm, and we're super, super healthy. Okay. And for me, and this is, I really want you to think about your clients here and what you may have seen in clients. Fascia holding is the name for when the fascia is affected by emotional stress and trauma. That slick and slippery material that's happy turns into glue, right? Forming tree trunks of restriction. Tree trunks of restriction. It's clamping down on our organs, muscles, and nerves. And this is what I see in my clients' bodies. Stiffness. Think about what you see. Pop it in the chat. Spinal posture, their pace, advanced aging, physical pain, their gait, inflammation. So William Reich, who I mentioned earlier, would call this character armor. So this is how the unconscious manifests into real time, right now. What's going on in my shoulder? What's going on in my hip? The character armor, this physical manifestation. So this is where fascia houses trauma in the body. I'm just going to show you this little video so you can see it moving. So I really want you to visualize that when something happens, that the fascia, the liquid, it goes like thick glue. And it's interesting when we think about our clients, how they may have had, whether it's childhood trauma, where one thing leads to another thing. And then they're at the doctors with a bad hip, the bad leg, the bad this. We know where that's come from. We usually have a hunch where that started, but how one ailment can lead to another ailment. I'm going to pin this on the fascia again. So there's a great quote from Bezel here saying that trauma comes back as a reaction, not a memory. It's always embodied. It is always embodied. Always. So let's just have a little look at this guy, and he's called Cody here. Let's meet Cody.
I'm going to give Cody a pretty severe myofascial restriction at his right hip. Good. Now, first of all, can you see how Cody has started to kind of develop some interesting posture? Good. Cody, try to lift your arms for me, please. See where the restriction is? It's even worse than before, by the way. Did you notice that? and then drop the arms back down. Now, Cody's going to attempt to walk with this myofascial restriction. So we're going to go for a little walk, and he's going to walk a little bit interestingly, right? Okay. And we're going to back it up so we don't follow Dr. Rob. Good. Okay. So what I want you to see is that, first of all, you already saw how this affects his shoulders. Think about his neck. Can you imagine what might be happening at this hip over here? How that might be compensating and actually wearing on things, maybe even wearing cartilage from the position. Of course, this hip is probably not very happy, and this knee could have serious problems. With this pattern, Cody can have plantar fasciitis on his left foot because it has to deal with severe loads and modified impact with every step to try to stabilize him. This is the interesting with fascia, where you think it is, it ain't, okay? And the other point is, can you imagine his lumbar spine? I dare anyone to go for a walk with this, half an hour. Tell me how your back feels. Okay, so I'll set Cody free, proverbially and literally. Thank you, Cody. Everybody, please give him a hand for being sorted.
Okay, so I hope that was a useful visual around where the fascia, when the fascia, and we see it in our clients, that then there's this ailment, then there's this ailment. Some of it's mechanical, some of it's not, but where did it start? Where did it start? Think about aging as well. Stiffness and aging. Yeah, you can see it on people. I think it's maybe the yoga. It's not, it's because I'm dyslexic. I've always seen bodies and people and movement, and that's why I'm drawn to this. And I have a client who, when he's not well, he will walk into the room. I can usually tell by the tone of their voice, but even if I just see him walking, and he's about 33 now, that he walks like he's had a stroke. When he is not well, and there is stuff going on, he's walking like an old man who's had a stroke. The legs getting dragged, the shoulders drooped. So just think of your clients, how the material, how the trauma, how, anxiety, depression, the shit that's going on that's making you feel like that is manifesting in the body, from the unconscious. So a client of mine once described, because I'm really wanting you to start speaking to your clients about the fascia. It's a real thing. There's nothing here about chakras or made up things or anything like that. This is science. So we can talk about our fascia, something physical here. So, and when you start to describe this to the client, let the client talk about it. They know what it is. Even when I'm teaching the yoga, I bring the fascia in and notice that stiffness. Okay. So a client of mine described her fascia as being made of glass. And that fits within her narrative, her story. But for me, this reminds me of Merleau-Ponty's words. So Merleau-Ponty was a French phenomenologist, and I love this quote: "Things are encrusted into the flesh of the body, just as the body is part of the fabric of the world." Let me say that again. You might need to work that out yourself. Things are things. There it is, things. What are things? Things are encrusted in the flesh, just as the body is part of the fabric of the world. Everything is connected. All cells are in contact with each other through this body-wide network. So flesh, and I put a picture here of Lady Gaga. So really what we're taking it from the unconscious, something, the trauma, the emotional stress, what is going on, manifesting in the body. Yeah. And we need to bring it into the flesh now, real time, what's going on. So flesh indicates a certain experience of a surface. Flesh, it's a surface, but it's got an inside. And it's that point where the inside and the outside meet. Merleau-Ponty referred to it as that matter is pregnant. As in, when we can begin to bring that into awareness in sessions. A lot of this is all non-verbal as well, so that you may have be working with clay. I'm glad we've got our therapists here. I'd love to hear when we talk a bit later, maybe put something in the chat. This is what you're working with, right? So please share some of your wisdom here. That matter is pregnant. matter is. So we're bringing it to the here and now. The body's in the room. What's going on? So more this lovely quote, the flesh is at the heart of the world. The flesh is at the heart of the world, from Merleau-Ponty. Okay, so I'm going to let you just percolate that, and I'm going to let's take a 10-minute break, and I'd like you to go and move, breathe, have a dance, whatever you need to do in that time, and just let this sit with you in your body. Okay, and then we're going to come back and we're going to get into the flesh a bit. Okay, so we'll see you in 10 minutes. Welcome back. Did you have a break and a stretch and some air? So have a wiggle, have a move, do what you need. We've got another section now, and we're going to jump back into the body here. So a little bit more. Keynote 1. Right. Okay. So let's get into the tissues a bit. So this is more the blood, the flesh. That's where we're going here, right? So we've got the unconscious, these things happening. Why is this happening? But let's break this, make this physical in the here and now, what's presenting to you. So a bit of the science stuff that I believe there are several types of fascia are helpful to us when we're working in mental health. There's loads of different types of fascia. It's like different types of fish, right? But these are the ones that are useful for us rather than doing a master's on fascia. And it was actually fascia, I did just check there, it was the name Fascia was from 2 footballers that were brothers, and Jason Fashanu and John Fashanu. Remember one of them came out as gay? So I'm just putting these things in your mind so you remember how to say the word. It's quite a sad story, actually. Okay, so the fascia, superficial fascia, right? So I want you to imagine, so if your body's like an orange, your skin is the peel, and then we're going inside, right? So the outer peel is your skin, your muscles are the fleshy orange fruit, and it's the white membrane, you know, the white bit inside. That is the fascia, right? So we've got the superficial fascia. It's highly elastic, and this is just underneath the skin. Highly elastic, fibrous tissue that's well organized. It's under the skin, separating the skin from the muscles. It allows them to slide on each other, and it can display properties. This is interesting, again, with what Helen just said, properties of being solid and liquid. It's involved in circulation, heat regulation, lymphatic flow around the body. We've got physical therapists here. I'm going to ask you to maybe, we'll chip in on this in the group when we'll go through this, okay? So I'm interested what the physical therapists feel. So just hold that in mind when we can share that with the group, because you're feeling this stuff in the fascia. Now, the deep fascia is often referred to as the silver skin by hunters. I have an awful flashback of being in a butcher's in somewhere in the northeast as a child, having to be dragged in butchers and seeing rabbits being turned inside out. It was disgusting, really. But I remember this silver skin. So that's what it's called by hunters. Yeah, it's a very fibrous layer, often in flat sheets, and it has tissue pockets covering the muscles, nerves, organs, and glands. It doesn't contain any fat. If somebody eats a lot of meat or chops up meat, you may have some visuals coming to you here about types of meat. Somebody shared something about a type of meat last time. But what's very interesting in this deep fascia, remember, it's continuous, tip of the head to the toes. There's 640 discrete pockets surrounding each muscle to keep them separate, so they're not flapping on each other. Okay. Then there's something called the meningeal fascia. So this surrounds the nervous system, this type of fascia, vagus nerve. Remember, everything's connected on the Wi-Fi, so we know what's going on. And the brain connects the brain, vagus nerve, and the winner for us here is the autonomic nervous system, right? So think, we're being hyper aroused, fight, flight, freeze, think of freeze. The body freezing, parts of people, think of your clients, parts of their body remain frozen, often with trauma. Often they've been frozen for a very long time, completely disconnected. Yeah. Then we've got something called visceral fascia. The visceral fascia surrounds the heart, lungs, and the abdominal organs, right? So this is suspending the organs to the wall of the body, allowing them to move and expand. Yeah. So the body is a mirror of the psyche, just like that beautiful quote that Lucy put up. Yeah. It's interesting, you know, just think about your clients. That picture is quite powerful for me of that young person there. And then we move to, you know, the vagus nerve and the power of the vagus nerve. But the fascia is housing 25 million nerve endings in you right now. Right now, that's loads, isn't it? So the fascia is the largest sensory organ in the body. Wow. Profoundly intertwined with the nervous system and vagus nerve, plays a vital role in the function of the immune system. Wow, again, stimulated by pressure and vibration. This is amazing, this. The amount of sensory information being relayed across the whole network of fascia is greater than that of vision. Wow. Fascia is the body's largest sensory organ. Okay. I'm going to just share this lovely quote here. So fascia is a whole body endocrine organ transmitting hormones, the hormones adrenaline, estrogen, insulin, thyroid. Think of everything that people are showing up with, the clients. Oxytocin, neurotransmitters, serotonin. Think of the impact of antidepressants, heavier drugs on clients, the medication. Yeah, dopamine and GABA acid. So we're going to just, if I can ask you just to start thinking about some clients here and who may be coming to mind for you. So our interest here, and again, it's why it freezes up by what happens to the body with the sympathetic nervous system. So when our clients are hyper aroused, yeah, this is where the body becomes, and you'll know your own clients, the people that you're working with, their body becomes immobile. They may collapse, feel stuck. These are their words. Clients aren't on workshops learning these words. They're coming in and telling you, I feel numb, frozen. I feel like there's deadness in my body. Yeah. The fascia clamps down and restricts what it contains. Also think about that it hardens overnight. Just notice your shoulders, do they feel a bit looser from this morning? They harden overnight when we sleep and in cold weather. It's called fuzz. It's called fuzz. And I'm going to show you about this once we've had a little breakout. And over time, this fuzz layers up. Imagine if you haven't had a stretch in 2 days, a week, a month. If you're in hospital, if people are in hospital and can't walk, can't move, over time, it's associated with chronic pain, the invisible stuff that doctors don't know what to pin on, and the bloods come up clear. Fibromyalgia, ME, chronic fatigue, inflammation. Okay, so we're going to take a breakout group now. Where was time? Let's take 15 minutes. There'll be groups of 4. And I'd like you to just talk about who's coming to mind for you. Maybe it's a client. Bring something physical to share. So you'll have about 3 minutes each. Deeper now, we're going to go a little bit deeper. What's you talking about, you're wondering? Well, let's see. So let's meet this guy, Gail Headley. He's bloody great. I'm researching, I'm writing quite a bit on this at the minute. And in that research, I read this random article from, I don't know, it was like 15 years ago. I've never read such an enthusiastic thing in my life. This guy's enthusiasm jumped off this random thing. Turns out it's this guy anyway. So let's meet him. He's brilliant. So he's going to talk to us about this fuzz a little bit deeper.
Each night when you go to sleep, the interfaces between your muscles grow fuzz potentially. And in the morning when you wake up and you stretch, the fuzz melts. We melt the fuzz. That stiff feeling you have is the solidifying of your tissues. The sliding surfaces aren't sliding anymore. There's fuzz growing in between them. You need to stretch. Every cat in the world gets up in the morning and stretches its body, and it melts the fuzz in the same way that the fuzz melted when I passed my finger through it. When you're moving, it's as if you're passing your finger through the fuzz, just like I did on the cadaver form here. So you have to stretch and move and use your body in order to melt that fuzz that's building up between the sliding surfaces of your musculature. The sliding surface, those shiny white surfaces of the rectus femoris sliding against the vastus intermedialis. So these sliding surfaces are all over your body. The fuzz is all over your body. And as you move, you melt the fuzz. Now, what happens if you get an injury? Ah, my shoulder. My shoulder is stiff now. I'm holding my shoulder. I go to bed. I wake up in the morning. I don't stretch my shoulder. I'm afraid it hurts. So I walk around like this. Last night's fuzz doesn't get melted. I go to bed. I sleep some more. Now I have 2 nights fuzz built up. Now 2 nights fuzz is more fuzz than 1 night's fuzz. What if I have a week's fuzz or a month's fuzz? Now those fuzz fibers start lining up and intertwining and intertwangling, and all of a sudden you have thicker fibers forming. You start to have an inhibition of the potential for movement there. It's no longer simply a matter of going, oh, stretch. Now you need some work. Now you might need to do a more systematic exploration of that place to restore the original movement that you lost. And usually this is the case. We have a temporary injury and we restore our movement. But sometimes we call this aging, the buildup of fuzz amongst the sliding surfaces of our bodies so that our motion becomes limited, the limit cycles become introduced into our normal full range of motion, and we start to walk around like this. We're all fuzzed over. Our body is literally solidifying. We're reducing our range of motion in individual areas of our body, for our entire body in general. So I believe that one of the great benefits of body work, whether it be massage or structural therapies or physical therapy or any kind of hands-on therapy, these types of therapies introduce movement manually to tissues that have become fuzzed over through lack of movement, whether the lack of movement is because of an injury and a person's protecting that injury, or because of personality expression. That was many years when I just walked around like this, I was very still and monk-like. So, and then I became a little more dynamic in my personality when I realized what I was doing to myself and the kind of life that I wanted. So you can grow fuzz by choice or by accident or whatever. And yet here, now you've heard the fuzz speech, you know that you can take responsibility for melting the fuzz. And if there's too much fuzz in your body and it's frozen up, you might want to seek help in order to introduce movement so that the new cycle is a little more movement and a little more movement and a little more movement instead of a little less movement, a little less movement, a little less movement. Fuzz represents time. The easier it is for me to pass my finger through the fuzz, the less amount of time it's been there. If I gotta whip out my scalpel to dig my way through one otherwise sliding surface and another, you know that that's been building up for a long time. So you can actually see time in fuzz.
So that's Gil Headley. I will send you his website. He puts loads of free stuff. So the fuzz, so we can melt the fuzz. Again, I would like you just come back into your body right now. Just bring your hands to your knees, drop your chin to your chest, arch your spine back. You may want to take the gaze up, roll the shoulders, squeeze the shoulder blades. Notice a lengthening at the front of the neck. You might want to sip a bit of breath here. Arch the spine back. Bring it back up. You know, I think it's one of the most boring yoga poses, cat-cow, but it's probably one of the best ones for fascia. Super simple. You can do it and start to move it and get clients to notice your edge and it'll melt. So there'll be more movement there than there was this morning. How are you going to melt your fascia? Melt your fascia. Brilliant, isn't it? Mind, body, what's going on? Right, let's get a bit more gory here. Right. So the immobility is recreated internally also. So the digestive system, let's get to the guts of this, right? Think about our work with mental health and the guts, the second brain, right? The digestive system is the largest area of fascia in the body. Wow, right? Emotional immobility can create constriction in the guts and bowels. Think about the IBS, the clients with the IBS. Put other things in the chat there, but the colitis, what's the other one called? The one with a C, there's another one, isn't there, with a C. The gut brain.
Crohn's disease.
Spot on. Crohn's. Yeah. The gut brain axis, the second brain, it's known as the tummy. Get the clients to get curious about this, right? This is where it shows up. IBS, goals. Oh, I put Crohn's there. Yeah. Celiac, another C, right? Ulcers, many autoimmune. Think of the guts, the digestive system, hungry, not hungry, anxiety with the cortisol. Yeah, please put stuff that's coming to you in the chat because we're all interested here, right? So the gut contains over 1 million nerve cells encased in fascia, constantly informing the vagus nerve to brain. The Wi-Fi's on. Yeah, so I'm going to let's look at the kidneys here. So the Titus Little, who, if you're interested in yoga and a bit of stuff like this, Titus Little, he's an American teacher, he's really cool guy. His workshops are really good, saying that the kidneys are the battery pack of our bodies. When we're dehydrated, they tighten up. Yeah. Think about our clients, trauma clients, when clients aren't well, they don't know if they're hungry or thirsty. Not just children, when a child doesn't know if they're thirsty. So glad the kids have water bottles now. I think that's massive, the kids noticing that. But often people struggle to notice if they're thirsty, hungry, need to go for a wee, need to go to the toilet. Yeah. So in the freeze response, we are disconnected and we lose contact with our body and our agency is gone. So I'll give you a quick case study here. That during the pandemic, I had the great pleasure of working with a young woman, Savannah, who had a history of trauma and having not healthy relationships. Her GP had diagnosed her, she's 24, had diagnosed her with ME and chronic fatigue syndrome. She was always at the doctor's. There's a bit of getting attention there as well and getting looked after because she didn't have that from her mother. Lots of physical pain, and the GP, the scans, everything, they said her kidneys weren't working, the liver wasn't working, the gallbladder. They actually wanted to remove our gallbladder and do surgery to remove our gallbladder, right? Gradually, thank God, in the therapy sessions, she began to notice when there was external stress, emotional stress, and that's when the pain started. That's when the discomfort started. And look, and those toxic environments that she was in were manifesting in her body. So it led to her making healthier choices. And when she moved away, I knew she had choice to move away. Nothing's perfect, right? The medical issues subsided, so she didn't have the surgery. She cancelled the surgery. Now she listens to her body. She's able to prevent further pain and manage her own energy with rest, food, exercise, proper hydration. Yeah, and I see this a lot with the people I work with in recovery as well. So it's that noticing. So yeah, when we begin to notice, it's the golden gallbladder. That's what we called it. So now let's look at the vagus nerve in fascia. So the wandering nerve, in Latin, it's known as the wandering nerve. And it's crucial for communicating changes in the fascia to your brain and regulating the nervous system. You got that picture, Sarah? Will you put it up? You got that picture?
Yeah, no, I'm trying to take notes and listen to you at the same time. So.
Oh, okay, I'm sending you the slides anyway. So it wanders from the brain stem through the neck, thorax, organs to the abdomen. It's the chief neurotransmitter of the parasympathetic nervous system, and 80% of the vagus nerve fibers connect body to brain, right? It is encased in fascia, sending messages to reduce heart rate, anti-inflammatory chemicals. I'm just thinking about what Claire said there about the dissolving the cortisol into the bloodstream. Obviously, the vagus nerve will control, if we're stressed, we go to fight or flight, and the sympathetic nervous system speeds up, but there's a healthy way of managing it, because when it slows down, it can provide a vagal brake to slow us down. So everyone's excited about the vagus nerve. I think it's sort of maybe dropping off on popularity a bit now, but it's encased in fascia. Remember, it's down to the stomach, the major organs, constantly communicating. And the brain, right? So the brain and fascia. So the brain is encased in this meningeal membrane. But until recently, really recently, the people just thought it was cushioning for the brain. bit of padding. But neuroscience have now discovered that the fascia contributes to the blood-brain barrier, communicating via the vagus nerve with the central nervous system. So again, we're all connected. So allowing the brain to monitor data, receive information from all of the organs, but in particular, the brain. And I just want to have a lot more on this. I'm just giving you like little pipette bits on the top here, but the organs, it's obviously all of the organs, but I'm particularly interested in the heart, and I'm going to give you an example. So all our organs within the main body cavity, right, from the base of the skull to the pelvis, they're double bagged. You know, in a shop, I don't know if you've got a co-op near you. I don't know if you have a co-op in South Africa, but they've got these stupid thin bags. So you've got to have a double, you know, when you double bag things. So our organs are double bagged to keep everything sliding, lubricated in movement. So tone of fascia is important. Tone of fascia, so that organs don't become restricted, fall out, or things clamp down. That word, that's quite powerful, the clamping down. So our hearts are encased in fascia. Yeah. Gunnar Spohr quotes, and he says that the heart is a fascia organ. Where I see this is when emotional stress and trauma tightens, hardens, clamping down on the heart. This leads to messages that misfire, incorrect data. Remember the matrix? It's like data. I'm like a data tech person, right? The data is not right. And it's telling us when we're maybe not safe, when we are safe. Trauma, right? Trauma, not going straight up to a hyper-aroused state. So I'm sure a lot of you are aware of this and have clients who do this, but in particular, I have one client who during the pandemic was at A&E. She thought she was having a heart attack. And if you know anyone who works in A&E, they'll tell you that these people show up. Yeah, Rebecca, you're nodding. Do you know about this? Do you want to? All right. I just thought you might have worked with knowing someone in A&E.
I remember watching, I think it was a 24 Hours in A&E programme. I don't know if anybody else has ever seen it. Yes. And there was a case of that on there, a young man.
The anxiety, with the anxiety.
Yeah, and he thought he was having a heart attack.
Yeah, and absolutely. So when I do have this a lot with clients, but this client in particular, Nisha, she was showing up at the A&E, sometimes in an ambulance, sometimes just getting a husband to take her there. And yeah, and it was anxiety because the fascia was clamping down. And also I've seen it was with this client as well, but I've seen it in other clients that when they've been with a personal trainer, when there's a history of trauma, that when the heart rate, remember the body remembers, the fascia's remembering, that clamping, when the heart rate, she was doing, you know, the hardcore stuff where you throw tires about and things like that. It was kicking it off. And I've had that a few times where have other people seen this with the physical stuff, it's just too much. And then they're just flooded and they go into freeze, really impacted. One doctor had said to a man I work with, because he's another one who was in all the time, the doctor just said, you need to go for a run. I need you not to come here. You need to go running to burn the adrenaline off, to burn the cortisol off. Yeah, so I just wanted to share that example with you. So it's that clamping down. Okay, so let's just take 5 minutes now, because we're going to segue into the last part. Let's take 5 minutes. There's a bit of letting go, get what you need. I'm going to play a song that's about 5 minutes. It's got a bit of energy on it. And when that's over, we'll see you back here. So I don't know, 25 past. Maybe that's a bit over. Okay, we'll see you in 5. Go and get what you need. Have a stretch out. Welcome back. Welcome back. That's Beyonce done. When Beyonce, that's a new song. It's about releasing stuff. I thought it was quite appropriate with a bit of energy on it. So please, I'm going to ask you just to check in, just check out what can you do to feel more comfortable right now. We've been here for a couple of hours now, so just checking out, is it warm? I had to open the window, it was a bit warm for me. And what you need to do, grab something to eat, get some Scooby snacks or whatever you need, have a bit of a stretch. And we're going to move into the final part. Okay. So I'm going to ask you to, I'll just pop it on share screen. So, okay. Right. Okay. I'm getting a bit excited with the slides here. Right, okay. What I'm going to ask you to do is, let's just sit on the edge of our seat. Sit on the edge of your seat. I'm going to invite you to sit on the edge of your seat. And again, really just wiggle your toes on the floor. Push your heels into the floor. Heels into the floor. Noticing the ground under you, where you're sitting on the chair, or you might be on the floor. If you want to sit on the floor, sit on the floor. And I'm going to invite you to bring some rolls into the shoulders. Rolls into the shoulders, noticing that tension. Maybe try on one side, then the other side, and then maybe taking it in the other direction. Great. And then taking the head up, gaze up, and noticing the lengthening at the front of the neck. And then bringing it back, chin to the chest, arch the spine again. Hands on the knees, taking the gaze up. Noticing how that feels on your lower spine, mid spine. Can you squeeze the shoulders together, arch the spine back again? Great. This time taking the arms out to the side, just stretching up. So just take the stretch that you need now. You might want to go over to one side. So just from where you're sitting on, noticing here, rub your feet in the floor. Can you wiggle your fingers and wiggle your toes? Are you able to notice the temperature between your fingers? You might need to have a look. Sometimes we notice and sometimes we don't. And then letting that go. Great. So we're going to bring in some of the functions of fascia here, and you've just done it. And the first one is called interoception. I'm sure a lot of you have heard of this word before. So interoception is known as the seventh sense. It is the awareness of what's going on inside of your body. So when I'm asking you to notice that edge, that tension in the shoulders, which we now know is the fuzz. So we're noticing what's going on here, because the human body is capable of amazing things, and we can interpret, integrate, and regulate signals from within ourselves. Okay, but what happens if our interoception and we begin to not notice? Okay, so interoception is necessary to bring our attention to our own needs. Think of our clients who often don't know what they need. They don't know what they need. And it's essential for everybody's sense of embodiment, motivation, and well-being. So in our work, repeatedly people get stuck in their feelings and they get numb. And when the interoception, that noticing, so Claire mentioned trauma-informed, I teach you trauma-informed yoga that is trauma-informed. If we can start to notice that and have choice around that, this is what we're doing. We're getting people to notice, our clients to notice what feels good, what doesn't feel good, is the tension. Because when the interoception is dysfunctional, it plays an essential component of many neurological, psychiatric, and behavioral disorders. So a better understanding of interoception within our clinical work and client work may provide new ways of working with nervous system disorders. Specifically, I'm thinking about addiction here. So both good and bad sensations are triggered by all these millions of nerve endings, and they're going through the brain, the insular cortex of the brain. Trauma survivors and our clients experiencing anxiety and depression, they're frequently disconnected from what's good and bad for them. We see it in our work all the time. What's good and bad for them, people that are good and bad for them. So what I notice in a lot of my work is around interoception in the recovery space and veteran space. Lots of people come up to me and they're hypermobile. So the work here is that they don't know the edge with alcohol, with drugs. They don't know where they end and another person begins. So there's the boundary issues. I'm just throwing that in there. And it happened just the other day when I was at the recovery college as well, another person who's hypermobile. So the work there is to notice where I would like my edge to be, bringing it into the here and now. Yeah, It's fascinating. And we're just going to hear from Bezel when he talks about interoception as well.
The greatest frustrations that I see in the tens of thousands of clinicians who I train around the world in the treatment of traumatized people is that their patients keep getting stuck. They getting stuck in having too many feelings, by being overwhelmed by fear and feeling shut down and unable to engage. So the great challenge in treating traumatized people is to help them to be focused and to be present in the here and now. And talking alone generally does not do that. And so what is necessary for us is to begin to explore how people can become still and focused and be present in the here and now. And there, a major avenue was learning about yoga and learning about traditions that are not Western traditions, not part of Western psychological traditions, but traditions that have been practiced in China and India and in Africa for thousands of years. And those are practices that have to do with, one, interoception, noticing yourself, feeling yourself, and learning how to quiet yourself down through movement like Tai Chi, through breath as you find in yoga, and through movements that help your body to calm down and to come into the present. So people may start taking a yoga class, and initially when they have any feelings at all, they become so freaked out by those feelings that they need to cut themselves with razor blades to make those feelings go away. And now they take a yoga class. And the yoga teacher says, notice your leg, notice your butt, notice your abdomen when you make that twist. And the calm voice of the yoga teacher and the quiet encouragement to just focus, to not associate, and the guided voice, the guided power of breathing, to just feel what you're feeling and to notice that your feelings are there and keep changing. And when you focus on your toe, you have a different feeling than when you focus on your knee, which is a different focus than when you feel on your butt. You become aware of what actually goes on in your body. And the next time when somebody doesn't say good morning to you, or you are working very hard, you don't get overwhelmed by your feelings. You notice what goes on in your body. And instead of cutting yourself, you may take some time to breathe and to notice what's going on and to restore that inner sense of calm without popping a pill, without taking a drug, or without mutilating yourself. But that's a function of learning to trust yourself and to know yourself. But that can only be done if you practice and do it regularly with the guidance of somebody who trusts that you can eventually establish that sense of ownership over your own body. Try to imagine how yoga might impact your practice.
Okay, so that's Bezel. I wanted to bring him in, but also I've just put a few notes in because I'm actually encouraging you really from right now, just stretch your arm and pull your hand back. Notice your fascia now, notice your tension. Pull it back the other way. Maybe your feet lift a leg up, which is tighter than the other. I'm encouraging you to notice your fascia in the shower in the morning. How do you want to stretch? What feels good? What does your spine need? To notice your edge. So we have that as a language. And this is quite active. I'd like you to start doing this really from now. What you know, is this interoception? Okay, am I noticing? What am I noticing? Noticing that edge. And again, I just want to make it clear that as well for people who teach yoga, this is how you can bring it in. But also if you're working with clients one-to-one, just that notice and give it them as homework, right? Where have they noticed their edges? When are they really stiff? Yeah, you can be creative with that. I mentioned the hypermobile. And again, someone else mentioned about working with adoptive children. I can't remember who it was, but a lot of children who, it's not just children, it's adults, but where they, again, that not noticing whether hungry or thirsty, because a lot, this has happened a couple of times to me in the last few weeks, where with adopted children, where parents have adopted some children, but they can't cope because of, there's obviously it's because of childhood trauma, what's happened, but where the child will go to the fridge and just eat and eat and eat and not stop eating because they don't know when they're going to eat again. It's that really, it's primal, right? And I was working with a young person the other day, and there were some donuts and she'd eaten 4 of them. I mean, I know children eat lots of donuts, I know that, but it was quite just this, because she's a looked after young person, that the food you just, and yeah, so, and it was these donuts that just disappeared. Again, there's that imperception, that not noticing. Yeah, I'm just highlighting that, and I would like you to get curious that when your client work. So the next sensation, that Beyonce song's in my head now, is proprioception. Of course, it sounds the same, and I've put the same slide. So how do we notice this differently? So when I'm asking you right now, wiggle your toes, feel the carpet, feel your floor. Notice where your body's in contact with your chair. Your spine's in contact with maybe the back of your chair. Okay, just taking your hand up, looking up, so I know that my hand's up in the sky, and then I'm wiggling my toes as well. Okay, so proprioception, and it's interesting, we've got someone with vertigo on the workshop, if she's still here. And so proprioception is known as the sixth sense. So it's knowing where your body is in relation to the environment. So it's known as the sixth sense, and it's Latin for having a grasp on oneself. So a quick test would be finger and putting your finger on your nose. Putting your finger on your nose. Okay, so very much within the trauma-informed yoga, I'm always going back to feel the ground under your feet, wiggle the toes. So we're constantly, we're checking in with the lengthening, the interoception, and the proprioception, so we know where we are in time and space. Okay, and when our proprioception receptors are restricted due to emotional stress and trauma, this makes us inflexible and can damage our overall health. So a recent study by Dr. Helen Langevin indicated that chronic disease, pain, and inflammation result from the abnormal function of proprioception through the body, especially the joints. Okay, so like I say, what I notice is poor balance, but the more I've in people that I'm teaching, but again, I'd like you to just sit with this and notice, is it interoception, is it proprioception? Because I've noticed a few things, and this is about myself. So when I'm tired, my balance is out of whack. My mind and body connection, if I don't sleep well, might go from a 10 to a 2. Sometimes if I'm so tired, I might think I can't even walk down to the shop to buy some fish fingers, or there's no way I'm leaving the house. Well, usually if I'm well, or if I'm not tired, I'm out doing this, I'm running, I'm this. I think I'd fall in a ditch if I went running. So it's noticing the impact of sleep apnea. I have a lot of clients with sleep apnea. So sleep is usually poor, again, when we're starting to work with clients who aren't well, whatever they're presenting with, the sleep's usually out of whack. And when the sleep's not right, we can get close to madness quite quickly. Again, proprioception, think about drugs. A lot of our clients want to self-numb, food, drugs, I'll be missing some of it, overwork, gambling. But again, for me, thinking about taking drugs, being off your head, you're not in your body, are you? Yeah, having a hangover, numbing. We don't know where we are in time and space. We don't know where we are in time. I'm thinking, a lot of people you see in the city centres on Spice, they're just off the fit, yet they're off their faces, aren't they? They're not there. They don't know where they are. Also, remember, some of this noticing might become completely overwhelming for some people because it's just too much. Also, just little random things just to get curious about where proprioception goes. If I don't have my glasses on, I can't see, but I can't do balances. in yoga, you always get people to put the glasses on. And interesting, a veteran I'm working with, Eddie, he said the only thing he could do before he could get into therapy with the waiting lists, when he'd come out and he was waiting, the waiting list, the only thing he could do to feel any control with his body was some yoga and mindfulness videos on YouTube. So very interestingly, that exercise, yes, yoga's great, again, for interoception, yoga's really great, but also let's look at other things that we can do, because so weights are good. How can you have your clients, if they're doing weights, to really feel their feet on the floor, doing it in their own time, that they're feeling the weight, get them to practice it, to be in the space. So it's what is not good for interoception and proprioception is putting your AirPods in and people going running. So basically it has no effect on interoception or proprioception. It actually encourages us to disassociate. So just to be mindful of that. How can people slow down, be steady? Know that they're being connected, notice their breath. And I'm doing a test at the minute where I'm coming away from yoga. I've been doing it for 4 months now and doing an online sort of workout thing, just to notice the difference in the fascia, the body, and all of this. And very often I'm completely disassociating, and I'm waking up in the middle of the night craving the stretching, craving the yoga. So different headphones on, no good. So then the final one, neuroception, this is coined by Stephen Porges, where this is where we need to have a good look around us. We're constantly scanning for safety, So the messages through our eyes, our body, because often our trauma clients, they've got their back to the wall. They know how to keep themselves safe as well. So please don't discount that. It's really about social connection and how the nervous system reacts to external stimuli. And really, where often we can go to a place where we think our life is in danger when it's not. And I'm just going to give this quick example about the horses. So people may never feel safe with other humans, depending on what's going on, but they might do with animals. This is just an example. I'm sure other client examples are coming to you. Pets, cats, dogs, iguanas, but also a few of my clients are into horses. I'm not, but I'm really interested in it. So it's how we can be in this safe space with neuroception with other animals. So this is a lovely quote around equine therapy. Horses are likely to have what science has identified as a coherent heart rate pattern that explains why we can feel better when we're close to them. A coherent heart rate is indicative of a system that can recover and adapt to stressful situations very effectively. Many times we just need to be in the presence of horses to feel a sense of well-being and peace. Remember, because a flea animal, a horse, when something happens, they go into hyper-arousal, run off, have a good shake, get rid of all that cortisol so it doesn't tighten up. So where are we going for a shake? This is why we're encouraging the movement. So we're just going to move now into some more things that have already been mentioned today, but techniques around befriending the body. Okay, so the science of stretch. So we've got yoga, we've got yin yoga, but not everybody wants to do that, and that's fine. So golf, other people in sporty people, I look at them, like golfers in particular, I see them, this sort of alpha thing says, I'm not going to call it yoga, with the roller balls, but I'm looking at it go, well, yeah, you're doing yoga, but whatever. What can people do to stretch, to move? What do some of your clients do? Is there anything you could put in the chat there? Yes, it can be overwhelming for trauma survivors. So this is where something trauma informed is really important, but just the gentle movement, vagal tone and breathing. So once we notice that our muscles lengthening, we can notice our edge. There's a line of resistance, and there's something there where we need to dance with that resistance, working with the breath, I haven't focused a lot on breath today, hardly at all. Breath and gentle movement allows the fascia to be healthy and experience the inner space and a real sense of wellness. So this is a quote, again, I'm bouncing back to the yoga, and we've got yoga people here. This is a quote by Tom Myers, where the phrase issue in the tissues comes from. So what the people who developed yoga recognized was that in order to change the person, not just to change the chemistry or to change the amount of strength you have or your readiness to dive off a diving board, but to really change the person that you are, to change the issues in the tissues, then you really have to make a deep change in the pattern of your body. It's quite powerful. And again, we've talked about this all through today, the power of massage. Yes, some people this is not appropriate for, some people it is. So I need you to trust your clinical judgment there. And we've got people here who are therapists. So with fascia, there's specific sort of copyrighted fascia, the myofascial release. I'd say all massage is good. Again, try and get a full body massage. These tools that we've mentioned, this is a Rolfing stick. Like Jeremy said, people would like run in the other direction. Very popular now. This is like a tool, so maybe people can share what tools they use. Or these are again for more alpha male sporty people, these gun things. I've seen this black gun. Who does it? People are sort of sponsoring these a lot at the minute. They look terrifying if you ask me. But again, Ida Rolf is more associated with the massage side. And she's known for where you think it is, it ain't. That lady with a stretchy suit on that video said that phrase. Acupuncture. I'm not a fan of acupuncture myself because of bad experiences. I would actually try it again. But when needles are, again, it's Dr. Helen Langevin, when needles are sucked into the body tissue, the loose fascia connects around the needle, right? So every time the needle was put in, it's impacting the fascia. So it's a bit like spaghetti around a fork. So just to be curious around these other methods. And just to take a breath here, because I know I've packed a lot in, right? So just have a breath, have a move. And we're going to do a checkout in a minute that Zina will take us through. I'm so interested in this, and I'm sure you are as well, but there are huge other areas, especially around mental health, okay? Neurodiversity, ADHD, autism. I was working with a lady the other day at the Recovery College, and at the end, she wrote a feedback to say that the fact that because she's autistic, she normally would not go to yoga, but because the trauma informed is slow and was telling her that she was on the ground. So there's impact for neurodiversity, periods, menopause, pain, posture, aging, right? Also intergenerational trauma. Twins. I am fascinated by twins. I love it when I meet a twin. Is anyone here a twin? I haven't got that on. I think I can't see everyone. Look at those little babies there. Look at that, right? So what happens with twins? The fascia, is the fascia the same? What's happening in the genetics, in the DNA, the epigenetics, when that gene may already be there, just waiting to be switched on by the environment. So here we're talking about generational trauma. When clients, I was working with a client who's has a lot of body emotional issues, and actually she's from Africa. She's from Africa. Her family are from Africa, from war. She's aware she has a privileged life now in Germany, but she knows the history of war and violence. And that is never far away from wherever you are right now. Wherever you are right now, that is never in another place. It's never far from your door. So again, I'm thinking about Ukraine. I just think this image is beautiful. Look how the grandma looks like the little boy. Do we have the same fascia? Have I got my father's nose, my mother's stomach? When we look the same, what about our organs? What's being passed down? What's being passed down? So I'm going to encourage you just to get really curious about that, because it's a huge subject, but just get curious. Just get curious. Check out so we can say bye.
Thank you.
Bye.
Bye. Bye.